The country certainly needs to be a lot more unified if it's going to survive.
For Americans, the stakes are just very high.
That's probably one of the few times that I deviate from my libertarianism is when it comes to the protection of our children.
The job has gotten a lot harder because you're doing more with less.
Progress is progress, and there's a lot of people working to make that progress happen.
It's either this or I have zero options.
I grew up knowing that the police were the most dangerous people that you're going to encounter.
You know, these things are just normal life.
Hello and welcome to episode 2 of Unpacking America, the podcast where we seek to unpack America one conversation at a time. My name is John David Easterling. I am your host. If you're joining us for the first time today, the basic premise of this podcast is very simple. I am an Australian. I've lived in America for 2.5 years. I find this country absolutely baffling. I love it, but I don't understand it. So I am sitting down with Americans from all around the country, different states, different occupations, different backgrounds, all the rest of it, and getting to learn a little bit more about them one little piece at a time. And in doing so, learn a little bit more about the country as well. Every one of these conversations I've had has been something I've reflected on for weeks, sometimes months after having them. There's a lot of depth in each one of these interviews, so please keep on listening, like and subscribe, do all of the usual podcast things, and let's just get into episode 2.
The amount of nursing knowledge that has been lost, like the nursing experience that has been lost, just totally priceless. And you're never going to be able to replace that. Like when I started my career 10 years ago, my mentors were nurses who've been working for 30 plus years, just like amazing nurses, so smart, so good at what they did. Now, nurses new in the ICU are getting trained by other nurses who've been working for 1 year. And that kind of stuff is like, A, it's scary, B, it's really sad. I don't know. It's a bummer for everyone involved.
So when I said that I'm trying to understand America and that I love it here and that I'm learning a lot here, one of the things I don't love here is the healthcare system. And this is coming from someone who lived in a country with universal healthcare. So it's wild to me that I keep hearing stories from people I meet saying things like they got very, very ill because they didn't go to hospital because they couldn't afford the bill. Or they've had to start a GoFundMe to get support so they can pay for treatments. It's just not normal to me. It's very alien. It's a very strange concept. And that's not all we're going to be talking about today. In fact, it's right towards the end we get into universal healthcare. Really, what today is about is understanding what it's like to be a healthcare worker in the US and understanding the difficulties and the challenges that our frontline healthcare workers are going through. So this conversation takes place between myself and Annie, who's a frontline nurse working in Albuquerque, New Mexico, and it's her story. So I'll stop preambling and spoiler alerting, and I'll let her tell it. Annie, thank you so much for joining me today on Unpacking America. I'm really excited to sit down and talk to you today and hear your story. So let's get right into it.
Awesome. Thank you for inviting me and having me.
So you're in New Mexico, and that's a state I have only a very fleeting encounter with. I was driving across the country this time a year ago, and we did get to stop and stay in Albuquerque, which was really cool. And quite an amazing place. But I'd love to learn a little bit more about it from someone who's living there.
Yeah, I mean that's most people's experience is that they've driven across it and stopped for the night. So I mean a lot of Americans who were born here don't know much about New Mexico either.
My experience started with an epic rainstorm in the morning, and by the early afternoon we were driving through a sandstorm. Like it was
exactly.
the craziest day of weather I've ever experienced anywhere in the world.
Yeah, there's like kind of the local joke is just that like you have like 4 seasons in one day.
Genuinely, yeah. And probably like an extra couple of seasons because, I don't know which season sandstorms fit into, but
yeah, it's the 5th season.
What is unique about New Mexico?
I mean, pretty much everything is unique about New Mexico, I think. I moved here almost 8 years ago, and I moved from the Midwest. And honestly, I mean, I still kind of feel like that it's kind of worn off a little, but especially the first couple years that I lived here, I just like I felt like I was living on a different planet. Just even just the landscape is so different. It's all like every day is beautiful. The sky is always beautiful. The history, the culture is really unique.
So you talked about being a transplant, and
Mhm.
I'm curious as to what it was that brought you out to New Mexico.
So I'm a nurse, and I was living in Chicago, and I wanted to I've always kind of had like, a travel bug. I actually considered going to Australia
Huh.
to work there. Yeah, I looked pretty deeply into it. I was kind of intimidated by the idea. Like it just was like kind of a commitment, and paperwork was like pretty intense. So I was like, well, something that's like a less huge of a step would be just to do travel nursing in the US. So my plan was to travel around the West Coast and, kind of roughly start in the Southwest and go up the rest of the way up the West Coast. And New Mexico, especially, I think like the only big things I knew about it was watching Breaking Bad. Also, Anthony Bourdain had an episode of Parts Unknown where
It is
he
a
came to New
brilliant
Mexico.
episode.
Yeah, exactly. And that would actually I remember like that really stuck in my mind. Like watching that was like, man, that like looks awesome. So I mean, yeah, I kind of was like, oh, that's a good enough place to start. And I interviewed for a job in Santa Fe that I didn't have like a great impression of. And Albuquerque is kind of the place where, it's like the medical hub of the state. And so everything kind of cool happens in Albuquerque in terms of medicine. So I was like, well, I might as well go where that is. So that's how I ended up here. And then I really enjoyed my job and my unit. And it's most travel contracts, it was supposed to be a 3-month stay. And then I renewed a couple times. And then I just decided to stay. I like it here. I don't really want to keep on moving around. And I've been here ever since. I've kind of pretended to to try to leave a couple times, but it's, they call it's the land of enchantment is the state motto, but the joke is that it's the land of entrapment.
Ah,
Hmm.
that does sound a little sinister, the land of entrapment.
I know.
That kind of makes me not want to visit, to be honest. But
It's like just too easy and good to live here. You just end up not leaving.
I do like that though. And 3 months became 8 years. Is that right?
Uh-huh. Almost. I guess 7.5 technically.
Wow.
Maybe.
And how has it been working in hospitals throughout those 8 years?
I've mostly worked at our main hospital here. It's like the one teaching hospital, level 1 trauma center, and it has like a sense of community, which is part of the reason I stayed here in general. It's just that it's just kind of I feel much less anonymous than I ever did in Chicago, and I enjoy that. I feel like I mean I know a lot of the people at the hospital, and it's small, but it's not backwards, if that makes sense.
Does make sense, yeah.
I've loved it. And it's kind of, I mean, it's kind of the thing where you can be a big fish in a little pond, where you get to see, I mean, we have the sickest people in the whole state come to us. I mostly have done like medical and cardiac ICU. Currently, I am working in like the pre-op, post-op unit. So I do see traumas now, but my background is more like medical cardiac, so more infections, organ failure, overdose, pneumonia, heart attacks, like all that kind of stuff.
So during COVID, well, I mean, I say during COVID, are we still effectively in COVID as far as it's concerned in a hospital?
It's more of just like the new normal, honestly. It's definitely become just kind of more routine. Like the first year or yeah, the first year was definitely like the height of just being like basically until everybody started getting vaccinated, that was much more stressful. And then kind of after vaccinations, became more prominent, then it was definitely took a lot of the stress out of caring for patients with COVID. We're all wearing masks. One thing that's changed is that they've changed the reasons why they would screen patients for COVID. So in the operating room specifically, like because my unit is part of the surgical services for the entire part of COVID, they every single patient going into the operating room had to get tested, and now they've changed the rules. So if you're over 65, if you're having any symptoms, or if you're going to stay in the hospital as an inpatient, those are the only reasons you get tested for COVID. So you could be an outpatient, 30 years old, asymptomatic, not gonna, it's like just something routine that you don't have to spend the night for, and you won't get tested.
And is that, as you say, that's made things a little bit easier and a little bit smoother now?
I think we all kind of think of that it's like a little bit crazy, where it's just like, okay, like we're doing this now, especially for the anesthesiologist, they're intubating people, which is like a procedure that'll aerosolize, respiratory secretions or anything that's coming out of your respiratory system is going to get aerosolized when you get intubated. And so they're intubating people in the OR, not knowing if they have COVID or not. I mean, especially for them, because that makes it definitely more high risk. But even for us, like there's never been, I've worked at two, I guess three technically different places during the COVID span. And in general, there's never been like everybody gets tested, like every visitor gets tested. There's just so many loopholes to even when the restrictions were very strict, it still was like, there's a lot of loopholes. Like I've never been tested for my job. Like they had
Wow.
employee testing where it was like, if you were sick, you could go get tested, but never like, we're just going to screen you to make sure that you don't have it before you come to work.
So never any mandatory testing.
Oh, never, not at all.
That does surprise me a little bit. But again, I mean, I'm from Australia, and I don't know how much you know, or sure, our listeners wouldn't know how rigorous things were over there. I left Australia just as COVID was starting to hit its warm-up phase, August 2020, when things were really getting bad. For Australia, at least, there was still very few communicable cases. It was really just not happening at all, but everybody was treating it like it was the Black Death.
Yeah.
And when I arrived in the US, one of the first things that struck me was, state by state were doing things very differently. But the messaging from the federal government was changing daily, if not hourly, at that particular time. Seemed just like such a crazy time to be, well, just to be, full stop, period, right? Just to be around was very weird. But I'm sure working in the hospital system, it must have been a whole different level of intense.
Yeah, just like very surreal, very like kind of at the mercy of like daily changes in protocol. And like we get the PPE that we were allowed, and then kind of, trying to shop online for, I bought my own respirator at one point.
Wow.
Just to have it, just because like I didn't know like if, how reliable my employer's source of N95s was going to be. And New Mexico, actually, our governor, she started, I don't know if it started her career, but she previously served as the state secretary of health. So luckily she had kind of a public health background, and we were one of the states, I think, that had very good management by our government. We shut down really early on in like March 2020. Public places were closed. We had a mask mandate, I think, nearly as long as anybody did. So kind of as good as we could hope for. And part of that is because our healthcare system is so not developed. Like we just don't have that many ICU beds. And so that's what happens is that, even if you can physically put patients different places, you can make tents, whatever, but you're not going to have ICU nurses. You're not going to have respiratory therapists. You're not going to have ICU doctors who can take care of them, not to mention just the ventilators, to run for people. Like we just don't have those numbers here. So I think that was part of the motivation. I mean, the same thing with Australia, right? Where it's like you just have like finite, if you're kind of like an isolated area, like if it runs rampant, like it's going to overwhelm your resources like in a way that you want.
Yeah, absolutely. I think one thing Australia did was shut its borders down very early on in the piece, and that did buy them time. There were a lot of restrictions and a lot of extra precautions in place, preventative measures, which I managed to dodge because I got on a plane and flew out of the country that allegedly had closed borders. But there were ways to sneak in and out. Not that I should be too public about that, but that's another story for another podcast. I think what they did was really buy themselves the time to prep for when things did get bad, and even then. With that extra, really, I would say 12 months to build up those reserves and supplies, it was still overwhelming when it did happen. But luckily, by the time things got really bad, the vaccine had happened in Australia, whereas that wasn't really the luxury in the US. And, the US is not a giant island that you can just shut off.
Yeah.
It just doesn't work that way. So it's interesting you say the healthcare system in this country is not so developed. And that's certainly been something for me that stood out, coming from a country with public health care and very reliable hospitals and all of that sort of stuff as well. It is a very different, it's a very different philosophy, or I guess mentality, to health and healthcare in the US. I've heard a lot of stories about people who'll avoid healthcare for quite a long amount of time because they're worried about the bill.
Oh yeah.
until it gets so bad that it's out of control.
Yeah, 1000%. I mean, that's the thing is that like we're extremely developed in a lot of ways, like critical care, transplants, can't like all the like kind of like all the things that are like once you're already very sick, we're great at taking care of you, like amazing kind of technology and treatments and everything else. But preventative care, like primary prevention kind of things, it's pretty abysmal because like even if you have insurance, which isn't guaranteed, you have a copay, you have a deductible, and so you have to get an appointment, you have to like jump through so many hoops. So it's just like a lot of people, I mean myself included, like you just kind of like avoid having to deal with that stuff because they don't make it easy
Until it's too late, right?
a lot of people. Yeah, for sure.
Do you see a lot of cases that come through the hospital that could have been easily prevented?
I'd say yeah, like in terms, especially with my background in like medical and cardiac intensive care, almost the majority of those patients are like what we call acute on chronic. So, they come in with pneumonia, but they also have COPD and stage 3 kidney failure. Like they have all these other chronic problems on top of like their immediate problem. And so I guess you could say any of those chronic diseases, like theoretically, probably could have been prevented with better health education or prevention or earlier treatment. Definitely, I worked in like a cardiac cath lab for a bit, which is when people have heart attacks, they get stents in their coronary arteries, and that's kind of a more like immediate example of somebody ignoring pain for you do get people who are ignoring having what they thought was indigestion or something for weeks or even months, and they come in, you're like, wow, you've been having a massive heart attack like this whole
Wow.
time. Like, so it's just not, yeah, like I don't think that like, oh, I'm gonna get this checked out is like usually a very easy decision for a lot of people.
And that's countrywide, do you think?
I think it varies more by your health coverage. I know that personally I don't have great health insurance. I have a pretty high deductible and I have copays. So if I don't really need something, like if it's not like, oh, I really need to get antibiotics or, something like that, or I need a prescription refill, I won't just like go get something checked out if I'm wondering about it generally. My sister, well, her husband works for Google and they have like amazing health insurance. They just cover everything and it's great. It doesn't play a factor in their decision whether or not to, go to the doctor.
It
But
seems crazy to me that you as a nurse working in a hospital don't have good health insurance.
oh yeah, it's
And someone working for Google does. Like that
yeah.
seems
Uh-huh.
that seems like it should be
Yeah.
one of the basic perks
Yeah.
of the job, right?
You would think. Yeah, and
Wow.
like to top that off, like I'm a student who I'm studying to be a nurse practitioner eventually. And I'm a full-time student. I'm working full-time. Eventually I'm probably gonna have to cut down to part-time, but I can't really even consider not working because of my health insurance. I don't want to lose my employer coverage because if I had to pay out of pocket to find my own insurance on like American like Affordable Care Act marketplace, it would be pretty expensive and I would already be taking a cut by not working. So and I can't they don't offer insurance through my university even though I'm a full-time student. Yeah. So I'm kind of just like I have to keep on working if I want health coverage unless I want to pay like a lot of money for it.
Gotta always be hustling, right? That is that's a common trait that I think a lot of Americans can relate to. Like it's just
Hmm.
it's a lot.
Hmm.
You guys work really hard and frequently are not that well looked after.
Yeah.
I'm still sort of sorry, I'm still back grappling with the fact that you don't have good health insurance and yet, you work in a hospital. That's just madness to me.
Yeah. I mean, it's like, okay. I mean, like, for example, like I had a UTI, I don't know, at some point in the last year. And, to diagnose it, it's like just like a really simple, like urine, like dipstick test. And like, for whatever reason, I got a bill for like $180. And it's like, why isn't this covered by my like by my plan?
Yeah.
Like, I had already paid like the $35 copay for the office visit. And it was like one of those things where it's like, I don't know, maybe it should have been, but also like ever having to call to inquire about the reasons for why things are billed a certain way or not covered for whatever reason is just all my experiences having to deal with that kind of stuff is just like so frustrating and stressful that I would rather just like eat the cost and avoid having to do
Well,
that.
that's the ultimate trick, right? Put as
That's
much
what they
red
bank
tape and
on.
bureaucracy in your path that you'll just
Uh-huh.
eventually give up. That's how they win, Annie.
I know, but oh my, it's like I find it like it's like seriously self-preservation because it's just like I can't. Ugh, I get so worked up. I hate it.
And to be fair, I'd also let them win. There's one thing that makes me see red. It's bureaucracy.
Mm-hmm.
And
Yeah, like
that is
unhelpful
another
customer service.
that is another thing that the US has developed into a fine art form. All the forms and acronyms and everything else that happen with anything involving any sort of government or insurance paperwork is it's just maddening.
Yeah, I mean, and that's the thing is like there's no way to really know like what you're getting charged for. We learned like because I have a bachelor's degree in nursing, and I'm in a master's program right now. Next semester I'm taking healthcare policy, which maybe we should have waited till after I took that class. I might have more insightful things to say, but basically like we don't like as nurses, as bedside nurses, we don't know like how much things are cost, but like I mean you can find out kind of, but like nobody really talks about it that much. Like,
Mm,
you occasionally you work with a doctor who's like, you know what, like let's not do all these unnecessary things, like whatever. But in general, patients aren't told at all what anything is costing. Like, and they're not given an option. Like we're just like, we go in and we draw, 5 tubes of blood, and they're not told that those are probably each $100 a minimum
wow.
on their bill. Like they don't have a choice. Like, and so that's kind of the fallacy I think with like American healthcare. It's like, oh, it's like a free market system, but it's like not really. Like when you're sick, you kind of don't have a choice, and
Yeah.
especially in New Mexico where it's like there's only one level 1 trauma center. So it's like if you need emergency surgery, you're like you can't shop around. Like nobody is reviewing your bill to be like, "Oh, that was an unnecessary treatment. You shouldn't have to pay for it." Like there's just no oversight like that I know of at
Wow.
least. So I
So
don't
who
know.
does do the billing?
I don't know. The billing
Wow.
department.
Yeah,
Yeah,
right.
I mean the billing department sometimes they get on us about certain things that we have to chart, and like a lot of times when they're really on our cases about like, oh, you got to make sure you chart like this specific thing. And a lot of the reason for that will be for billing purposes, where it's like we
Yeah.
can't bill for that unless
Yeah.
like the time it was started and the time it was stopped is documented.
I've had this conversation with a lot of people in my lifetime, though, but everything is a business, right? Schools,
Mhm.
hospitals, all of these things that people think are just institutes where we go when we're sick or we go to learn or we go this, that. No, 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 no. They're
Yeah.
businesses.
Yeah. And I just, I kind of like, I definitely hate that part of it. Even if the system is terrible, like people don't stop being sick. So, I don't know.
No, and that's it. You're a part of the solution, or you get up and walk away, right? That's kind of your only two options.
Yeah.
And
Yeah.
I know, just from reading articles and paying attention to what's happening in the news, there does seem to be a almost a national shortage of nurses at the moment. Certainly worse in some states.
Yeah, I mean, so basically COVID has just completely ravaged nurse staffing, partly because it just has gotten so hard. Like it's all just like a vicious cycle. Like staffing is so bad, the job has gotten a lot harder because you're doing more with less. And so I know a lot of people have gotten out of it completely, or they've gotten out of bedside nursing. So they've gone and worked at like, primary care clinic instead of working inside of a hospital. And then there's like the whole travel nurse situation, which is like, classically it's just used for, it's like a temp agency will, help you staff for staffing, like short-term staffing shortages. And
Mm,
in COVID, there just was like such a extreme increase in the staffing needs that all these agencies were offering just like exorbitant wages for travel nurse contracts. So understandably, like a lot of people took advantage of that. And then, but it's just like this vicious cycle where like a hospital will hire a whole bunch of travel nurses, and then their remaining staff nurses are working side by side with people who are getting paid like literally 4 times as much as they are per hour for the same shitty work. And
yeah.
so it's like, nearly everybody was like, why wouldn't you leave to go do that? And very few, I mean, I could be wrong, but at least the hospitals that I'm familiar with in Albuquerque, like did not offer any sort of like retention bonuses. So there was like really no incentive to stay and show loyalty to your facility. And, the more people who leave, the more travel nurses are required, and then it just goes on and on.
And again, I
Yeah.
mean, Let's take that business model again. And if you're a business
Mhm.
that's hiring travel nurses for 4 times as much as you would be, paying your regular staff because you have
Mhm.
a short-term need, eventually either those travel nurses are going to disappear and go to another hospital, or you're going to have to try and retain them. At which point, either you've got to bring their salary down to what's standard, or keep them at a higher paid level than your original and loyal staff members.
Yeah, I mean, all the contracts they're time limited contracts, and they're completely, there's like contracts, but the hiring facility can terminate the contracts at any point. They can change the wage at any point. So there's been several points during COVID where all of a sudden the staffing needs did drop. And, I knew people who had their hourly wage decreased by 30% or just got cut from the contract altogether, and they already paid.
Wow.
Like, for example, like my hospital in Albuquerque just doesn't pay as much as the other two hospitals in town. They're having like terrible staffing issues. Like they have a huge deficit in nurses. Like they have all these open positions, but the other places in town are offering like $20,000 sign-on bonuses, and we aren't. So, and
Wow.
they're also offering like 20% more an hour, and we aren't.
Mm.
So it's like, it's just, I mean, that's a free market for you. Like, why wouldn't you work somewhere where you're getting paid more? But for some reason, I don't know if I don't know. I just don't think nurses are valued in that way. Like, we're just looked at as an expense, not a resource. The amount of like nursing knowledge that has been lost, like the nursing experience that has been lost, just totally priceless. And you're never going to be able to replace that. Like when I started my career 10 years ago, my mentors were nurses who've been working for 30 plus years, just like amazing nurses, so smart, so good at what they did. Now, nurses new in the ICU are getting trained by other nurses who've been working for 1 year. And that kind of stuff is like, A, it's scary, B, it's really sad. I don't know. It's a bummer for everyone involved.
Yeah, I graduated in history, which is a useless degree for everything other than being quite philosophical about life. And I look at exactly what you're saying as all of these legacy employees leaving. There's only so much you can learn from a degree. So much of what
Mhm,
we all learn in our professional
mhm,
lives is on the job. And
mhm,
exactly what you've just said. If you're losing the collective knowledge of an entire profession quite
mhm,
quickly, it ultimately means that across the country there's a lower standard of nursing. And that's not to attack any
absolutely.
of the current nurses. It's just to
No.
say there's so much lost knowledge and experience.
Yeah, I mean, I feel bad for those new nurses because it's a scary position to be in. Being a new nurse, especially in the ICU, it's terrifying. And you need to have people who are helping you and guiding you and leading you. And that loss of like human and intellectual capital is just like intangible. And it's,
Mm,
I mean, the way like nursing training in America, I think maybe like, I feel like somewhere probably about 50 years ago, it kind of shifted from what they called certificate programs where you would learn, you were almost like not an apprentice, but like you worked, like it was like it was just like a clinical program where you worked in a hospital and you kind of like very hands-on training to be a nurse. But and
mm.
then they kind of shifted and there was a big push for bachelor's trained nurses. And so it's more of like the liberal arts degree with a nursing degree. Then you do, a certain number of clinical hours, but the way you really learn how to be a nurse is like the hands-on stuff you're going to learn on your first job. Like for example, like I don't believe I ever started an IV on a real human when I was in nursing school.
Wow.
So yeah, like I know tons of people, like I've talked about this with like tons of my colleagues and my friends where it's like, oh yeah, I never learned how to do an IV in school. Cause they're just like, we just didn't versus like people like friends I know who are paramedics, like they practice all over the place. Like they're required to get like hundreds of sticks. For nurses, like you're just not. And so there's just a lot of weird stuff about all of it.
When you say hundreds of sticks, that's hundreds of jabbing needles into people.
Yeah, like you need a certain number of IV starts, you need a certain number of all the different procedures that they're allowed to do. I know that they have like
Wow.
very strict, like to get through your program, you have to have somebody signed off that you did this many.
So on top of, and I would defy any American or anybody globally to tell me that if someone came in and was getting paid 4 times as much to do your job and work side by side with you, that you'd consider that fair or be satisfied with that
Mhm,
situation in any way. But aside from that fairly massive change out of COVID, the other reason that I read about that people are leaving the nursing profession is just pure burnout.
Oh yeah.
And doing multiple 12-hour day shifts in a row, 3, 4, 5, however many it ends up being, is just taking tolls on people.
Yeah, I mean, it's a very hard job. Like, it's exhausting from the time you clock in and get report until the time you clock out. Like, you're responsible for the patients under your care, and you like, you get breaks, but you have to like before you can go on a break, you have to make sure you endorse that care to somebody else. There's plenty of shifts where you just run your ass off the entire time, and then the busier you are, the sicker your patient is, the less time you have to chart, and so then even when you are ready to hand off to the next shift, you still have to sit down and chart for like an hour or two of all the stuff that you were doing all day. They just don't make it very easy. And my background, like I can speak to mostly to ICU nursing, but we're responsible for everything from literally fluffing somebody's pillow to doing CPR. And so you just have to like manage that entire range of complete care.
And that's a fairly broad range.
It's pretty broad.
Fluffing pillows to
Yeah.
administrating
Yeah.
CPR.
Don't get me wrong, like I love like the human interaction kind of stuff, but
Mm.
it's just very hard when you have like, somebody using their call bell for something silly when your patient next door is like trying to die. It's just like a
Yeah.
very like bizarre and difficult thing.
And something that I can't imagine is very easy to explain to patients either.
No, because I mean it's just like anything, right? Like it's just like any customer service. Like it can't be like, sorry, we have something else that's more important. Like I always try to avoid saying that, but sometimes you do have to be like, yeah, like we have a lot of stuff going on. We are here, but it might be a minute before you see any of us back in here. All that stuff is okay if you have enough help and you have like enough support from your management and from your team and you have the staff and you have the resources. It's like intense and it's hard and it's exhausting, but it's like exhilarating and fun and rewarding.
Yeah. Or when you're doing all that and knowing full well you could be getting paid
Yeah.
20% more with a huge sign-on bonus or 4 times more in a different.
Yeah. Or they're
that's
giving you assignments that just aren't safe. Like they're giving you, patients that should be what we call a one-to-one. So it's like one nurse to one patient. Normally the ratio in the ICU is 2 patients to 1 nurse. But with COVID, they just have been like pushing the limits where it's like they'll give you 3 ICU patients if they have to, and it's just like California has laws against that, but I don't think any other states do.
and
And
what's
it's
the risk with that?
I mean, just the higher the acuity, the, more attention and care a patient needs. And so I think the National Nurses Union recommends like safe nursing ratios to be ICU 1 nurse to 2 patients, step down units and other inpatient hospital units should be 1 nurse to 4 patients. So just because like you just really can't safely take care of, especially when patients are very sick, like there's only so much you can do as one human.
So the risk isn't to you, the risk is to the patients.
Yeah, for sure. Yeah, I mean to us in the sense that like we're dealing with like the moral the moral
Sure.
thing of
Oh
not
yeah,
providing
just your
safe
emotional
care.
and psychological
But
well-being.
also
Yeah,
our
yeah, yeah.
licenses, like
Yeah.
if something bad happens, like you are responsible and you can only do so much.
That's an interesting point as well around licenses and responsibility. I mean, one thing I will say is a marked difference in the US to Australia certainly is the number of people that are willing to engage in a lawsuit is astronomically higher here.
Mhm.
Do you ever feel that you're at risk of being sued or sort of legally held accountable for the patients under your care?
I mean, not in like a very immediate sense. They definitely emphasize like with our nursing education and in general, like that, like if you don't document something, it didn't happen. So they kind of drill that into us that like you
Mm,
have to, cover your bases. I think a patient is going downhill and I'm notifying doctors and they're not doing what I think that needs to be done. You document the hell out of that. Being like,
right.
Dr. So and so was notified. No new orders, that kind of thing.
Yeah. Cover your
And
ass.
then yeah, exactly. I mean, that's what they call it, like CYA charting, cover
Yep.
your ass. So that, I mean, there's like, I feel like for me, like that personally, like that's what I think of. I think the most common thing I've seen for my own, I think maybe once or twice I've gotten emails in terms of like patients who have experienced pressure ulcers, which are like, like bed sores. It's what we call bed sores nowadays, who were like suing the hospital for the fact that they got a bed sore and I was a nurse who like took care of them. And so basically it was just like I don't know what that's called in like legal parlance, but like an, information kind of search of like, hey, if like you're listed as like somebody who took care of this patient, we're collecting information about their stay at the hospital. Like if you have any documents at all, send them to us, which is like kind of silly because like everything's electronic and I wouldn't just have like pieces of a patient's chart sitting around. I think for doctors and other like licensed providers, that's more of a concern. But I believe I'm covered by my like hospital's liability insurance or whatever
Right.
it is.
Yeah.
So if anything were to happen, like they would give me legal counsel.
It's a nice umbrella to have.
Yeah, that's one thing we do have.
So, and this may be a very big question, but what would you change about the way healthcare is administered in the US?
I mean, I just think there should be universal health coverage. I don't claim to know a lot of the ins and outs of the policy and how that would actually be implemented, but just having just having health coverage and not having to worry about keeping your job to keep your health coverage or anything else, like that just would be such a freeing thing for so many people, and it would lead to such better health outcomes. Like so many chronic diseases could be avoided or better managed. I mean, it's just crazy to me that it doesn't exist. And it's like, I have friends in England and just like knowing like, oh, they just don't have to think about that. Like it's just like they can just be like freelance, do whatever they want, do contract work, and their health coverage just doesn't even play a part in their decision. And that would just be like so liberating. And people would just like it would just be better for everyone.
I can't imagine what that would do to a lot of people's state of mind as well.
Mm-hmm.
I just have to assume that that would relieve an enormous amount of pressure on people's lives.
Exactly. I mean, I just wrote a paper for one of my classes just about how like social determinants of health and how, poverty is a social determinant of health. I mean, being poor is stressful and stress leads to being sick, and like being sick is expensive, and then you put off healthcare. You don't seek help because you can't afford it, and then by the time you finally have to seek help, you're that much sicker and it's that much more expensive. And so it just would be so much better for everybody. And there's just like, so I don't know, like one thing that drives me crazy about America is just like people are just like always so concerned with like anybody getting something that they don't deserve, and like like they didn't earn it, and like why do I have to pay for somebody else's anything? And it's like there's just so little concept of like the greater good. Not only I think it's like the right thing to do as like humans is to provide healthcare for everybody, but also frankly economically it is better for everyone, because in general things will be less expensive if everybody is that much healthier. Like that is better for everyone, the same reason why everybody being educated would be better for everyone. But people are just so short-sighted, and so like that person on welfare has an iPhone, why should I be paying for that? I hate that attitude.
It's a really interesting point you bring up, and something I keep experiencing in the US is this inflated sense of self, as I've come to call it. And not all Americans have it. Please don't ever think that that's what I think.
I mean, I do, so it's okay.
Right, there we go. But this at exactly what you just said, this like what's in it for me.
Yeah.
It's the I got mine crew. And that's something, it exists in every country, but it exists in a more developed and aggressive way in the US that makes it a barrier for some people, even I think trying to see past their own noses at what the potential could be. It is a big piece of the American psyche I don't understand.
Yeah, neither do I. And I mean, honestly, like I feel like if it was a true just like referendum, every single American voted, like I think we would have universal healthcare. Part of the big problem is the way our legislature is designed, like the way our government is designed. It just makes it so difficult to get any actual big changes done. It's just so complicated to get anything actually changed.
Well, and there have been attempts.
Yeah, for sure. I mean, yeah.
And I'm sure there have been moments in the healthcare profession where you've been like, oh, this is it. It's going to happen. Or
I
maybe
mean, with Obamacare, that was like the big hope. Yeah, for sure.
I would imagine now, I mean, I talk to a lot of people in the US who are just politically exhausted and just don't see change as being possible, and to that point, not worth fighting for because it's a lost cause. It's a moot point.
Yeah.
And that's sad.
Yeah, I mean, I just think I don't know. I think I'm becoming more and more kind of fatalistic about stuff the older I get. But
I
Yeah,
think that
I don't
that
know.
that is, that is a sign of just being. I think we both fall into the awful category of ancient millennial. When you're 38.
Elder
Yeah,
millennials.
right. When you're 38 and someone calls you ancient,
Um,
you're just like, man, do you know what that
yeah, I
does
don't
to
know. I
me?
mean, yeah, I mean, I don't know. I think it's just like you growing up. I mean, I grew up, Bush came to office when I was in high school, and that definitely I feel like that was the turning point of the Republicans just like started trying to win at any cost. And then Bush versus Gore went to the Supreme Court and they handed it to Bush. And then 9/11 happened and Fox News happened. And the rest is history. I mean, I don't know, like you probably know more about this than I do, but some quote from somebody from New Zealand being like, why is New Zealand like such a nice, calm place? And they're like, we never let Rupert Murdoch into our country. And like, I feel like that's kind of the truth. Like, it really, like the Fox News thing is, I mean, all of this Trump stuff, craziness can be, all of its roots are all in that, like back in the early 2000s. And even earlier than that, like with Bill Clinton and them like prosecuting him for having an affair, like just these ridiculous things to get power at any cost. And Democrats just being like spineless and no progress gets made. I don't know.
You never thought you'd long for the days where a president was impeached for having an affair in the Oval Office.
Right? I know that seems so. Even like George W. Bush, like God, like we all hated him so much, like when I was in college and everything. And now it's like, oh, remember him? It wasn't that bad. He just started a couple wars, whatever.
So to bring it back to nursing and just sort of to put a final thought into what's been I feel like I ask a lot of people like what's been the big thing that's changed recently, and then when I ask that of someone like yourself, the answer is going to be very obvious, right? Because not many other no, I can't think of any other professions that were as affected by a global pandemic as you were.
Hmm.
But I wonder what has really changed in nursing for better or for worse for you in the 8 years you've been in the industry.
I mean, just the COVID, obviously, like, yeah, I mean, it was just the biggest possible thing that could happen in my profession, basically. And the how sick people were was like a horror movie to like take care of like the sickest patients all day, every day, and then having to see people on social media deny that it's even happening, when you were like, oh, we ran out of body bags. Like, oh, we can't send this patient to the morgue, they don't have any space, or like the funeral home doesn't have any space, like all that kind of stuff. Like it
You were
just was,
experiencing that directly?
uh-huh, yeah, for sure. Like that was like the peaks of COVID. That was my experience of like when it was really bad, like that's what we were dealing with, was like, that level of death. And then having, the rest of the world bitch about wearing a mask to the grocery store. And it's just like, are you fucking kidding me? Like
Yeah.
just that kind of level of like cognitive dissonance and like moral distress was just really hard. And I mean, that's a lot of the reason why a lot of people have left, because it just was too hard. Like it's a trauma. Like the PTSD as a
Yeah.
nurse, very, very real, and extreme levels of that for COVID nurses.
During that time when
Mhm.
you're running out of body bags and the morgues are full and you're treating people who are dying daily, did you ever think about just quitting?
Oh no, like I felt guilty that I couldn't do more almost. Like
Wow.
I mean, and that's the thing where it's like there's like a sick part of you that you're like, I mean, that's why I love my job, because it's like it feels important, right? Like it feels like,
Well, it is
oh God.
important.
Yeah, well, and I mean it is important and it feels important, and you're like, wow, what I'm doing actually matters. Like this is actually really important. And I mean, I don't know, maybe like, as like currently I do not work in the ICU. I'm not bedside. And I mean, part of it was because of I was already a bit burnt out before COVID, and then COVID was just like, kind of pushed it over the edge, where that model of bedside nursing is just so stressful. And I think a lot of people are just realizing that it doesn't have to be that hard. Like we don't have to do that every day, even though we love it and it's a great thing to do. It's just, I think that people the same way in all industries right now in America, it seems like, are like workers are kind of waking up to the power that they have. I tell so many of my coworkers when people are talking about switching jobs or negotiating schedules, those kinds of things, it's like they need us more than we need them in terms of like us with our employers. We have the power right now as workers, and I just hope that there's like a labor movement like that just like skyrockets
Well,
because of all that.
especially for nurses, right? If you've lost all of these people that have decades of experience and you have relatively new people in the field training the up and coming nurses,
Hmm.
to lose those people is going to
Hmm.
leave you with almost no one. So you're quite
Yeah,
right. I
just
mean,
Mhm.
you do have a lot of power.
Yeah, exactly. Like at this point, like I mean, I know that like I have and I can quit a job before I get another one, and it's like absolutely zero stress. Like it's just like no worries. I will, have 3 job offers by the end of the week. So that's a cool part of it for
I was about to
sure.
say that's not unique, but perhaps a very privileged position to be in post COVID.
Yeah, yeah, for sure.
I used to be a chef way back when, and I remember having all these conversations about how chefs will never be out of work because people will always need to eat. But
Mhm.
the first people to go during COVID
Yeah, all the industry
were
people.
hospitality workers. When I was 18 through
Yeah.
22 and I was working in kitchens, I I
Mhm.
never thought I'd see the day where there were mass
Mhm.
layoffs for hospitality workers. And then
Mhm.
every hotel and every restaurant and every bar just shut down overnight. As awful as the job can be at sometimes, it is a privileged position to be able to say I could walk into 3 job offers at the drop of a hat right now.
Yeah, absolutely. And yeah, I'm really grateful, and I had kind of forgotten about it, but like you reminded me of it. Like that was my refrain during COVID, was that like, talking about how crazy everything was, but it was like I always said, I'm grateful I have a job because, some of my best friends were unemployed for over a year, and I just my life frankly didn't change that awful much. Like my same schedule, and my work was the same, just worse. So
Yeah, well, yeah, well,
I do feel grateful. Like I just I know for myself I could never do a job that was just like making somebody else some money.
that's the option for a lot of people
Yeah, which I mean I'm privileged to have that choice.
is working for the quote unquote man. So it's a nice thing to be able to walk away at the end of a day knowing you've done something really good for people.
Yeah, hopefully I cleaned a lot of poop, wiped a lot of blood.
Well, we didn't get into the really the not so glamorous side of nursing.
Oh God, I have so many stories.
Well,
That'll
save
be
them.
the Patreon edition.
Yeah, we'll do an extended features version next season, and we can just get into all the poop stories. We might need to get a different host because I don't know if I've got the stomach for it.
Oh man, yeah.
Well, I always like to wrap things up on an inspirational note about the US, and part of this journey for me is trying to seek to understand and learn as much as I possibly can about America while I'm here. So, what is something you would say is an absolute must do to any visitor to the US or anyone who lives here that just wants to get out and experience more?
I would encourage everyone to visit New Mexico. It's a place that a lot of people haven't been, even Americans. And it's just everybody who's ever visited me here loves it. It's beautiful. There's so much different stuff to see and do. The food is delicious. We're famous for green chili. It's roasted green chili. They put it on everything. I mean, my favorite part about America is just trying out regional food, experiencing regional cultures, and I think this culture in New Mexico is one of the most unique of all of the ones that I've experienced. So
So, what time of year should people visit?
spring is probably like the most like it's like there's like a lot of wind in the springtime. So spring is actually not a great time to visit because it's very windy. But fall I think is the best. It's green chili roasting season.
I will
Um,
add eat roasted green chilies in New Mexico to my list.
do it.
Well, Annie, thank you for helping me to understand more about America. Some of your stories were harrowing and genuinely troubling, but I think it's something that people need to learn about and understand. What is happening to our frontline healthcare workers in this country is something that people should be aware of.
Yeah, thank you so much for helping spread the word.
A single conversation about healthcare in the US only really gives enough time to scratch the surface. It's a really big, really complicated subject to try and unpack. But I want to reflect on one of the last things Annie said when she was talking about the stress of the job and feeling like she was living in a horror movie. Directly experiencing running out of body bags in a hospital because the number of people dying is so overwhelming. It takes a serious amount of resolve to wake up in the morning and know that that's what's waiting for you when you go in to do your job. And to feel like you wish you could be doing more in the face of all that, it's an incredible passion for helping people. The nursing shortage in America isn't just ongoing, it's getting worse. These are your frontline healthcare workers, folks that sooner or later all of us end up needing to rely on. And whatever your personal views are on COVID-19, there's no denying that it brought to the surface a lot of pre-existing issues for nurses across the country. And now with record levels of burnout and the loss of experience from senior nurses, people leaving the profession, the future of nursing in the United States needs some serious first aid. And I agree with Annie's thoughts around universal healthcare. And this is one of the key things I'm trying to understand about America as I go on this journey with this podcast, because I understand the arguments for universal healthcare very well. I come from a country that has universal healthcare. But to try and understand the arguments against it, it needs to be more compelling for me than taxes are bad. I don't want to pay too many taxes. I don't want my taxes to go and help other people. I'm not saying it would solve all the problems in this country, but I know for a fact, coming from a country with national health care, it removes so much stress and so much pressure from people's lives. And as an outsider looking in, what I've seen in the US is that the way healthcare is organized in this country causes people to suffer unnecessarily. And as a nation that identifies with being Christian, having Christian morality and Christian values, that seems like a problem that needs fixing. Our next episode is focused on libertarian and conservative ideals, the nature of freedom in the US, and a whole lot more. And as always, there's a lot to unpack. So until next time, stay safe out there. I've been John Easterling, and this has been Unpacking America. Thanks for listening.